I think when we're young, there's so many opportunities, and if you have good guidance around what your interests are and what your skills are and how you manage challenges, then working within a health setting can offer all of that.
I wanted to work in health because I wanted to help people. I've always liked helping people. I enjoyed playing doctors and nurses when I was a little kid.
When I was a high school student, one of my career aspirations was to become a nurse. And funnily enough, after a decade or so of working, I'm still here.
For 13 years I worked for a corporate agency, and when I was pregnant with my second child I decided to change careers, and I was looking at doing early childhood studies. However, my second child had difficulties at birth, which very long story short, resulted in her having a stroke. She's fine, but just the care and support that I was provided by healthcare, I felt that I could actually give that back to somebody else. So instead of going into primary school teaching, I changed my direction into midwifery.
I love the staff. I love coming to work and working within the team that I work in. I've got many staff members, especially in theatre, that have been with the Women's for a long time, you know, sort of 20, 30 years, and they are still, you know, in those roles. So it says a lot for the culture at the Women's.
I'm inspired every day to come to work, and I think that's fantastic. I think my job inspires me because I know that I can make a difference, and because I love the people that I'm surrounded with. So the Women's surrounds me with wonderful people, and it's a wonderful place to work.
The support here is absolutely fantastic. The girls that I work with and a couple of guys that we work with as well are all amazing. A really great team, and the environment here is fantastic. We work with a wide variety of women, which is something that I really like as well.
I started off years ago at the Victorian Aboriginal Health Service as a dental nurse and just built upon that. So when I left school, I started working in dental health care, and then I moved on to healthcare work, and just a passion for health, I guess, and helping people.
I think for me, patient contact and being present with patients that are quite in a vulnerable period and supporting those patients is quite an honour and a privilege. And I think for me that is something that really drives me every day.
I would definitely recommend a career in health because it's rewarding. It's challenging work, but it's rewarding.
You only get to touch their lives for 24, 48 hours, but to make them feel really special and safe in that time. So definitely have people skills is something that you really would want to have. The theory will come.
Women in particular, as a group of patients to look after, they are inspiring, you know, the different needs that they have as patients. The fact that we get to experience the whole spectrum here with them, it's very rewarding.